My name is Dr. Shripad Pujari. I am a practicing consulting neurologist in Pune. Today I am going to share with you some information about a common neurological disorder, which is epilepsy. Epilepsy has been known to mankind since ages, and its descriptions have even been found in Sushruta and Charaka's books. It was also described in ancient Western medical literature. Epilepsy, over the period of years, has been becoming a commoner and commoner illness. The awareness about this illness is very small, and there is an enormous social stigma about this disease as well. First, let us understand the meaning of the term epilepsy and its common points such as how and why it occurs. Epilepsy means when a patient suffers two or more seizures, or what in lay people's term we call fits. Now, what is a fit or a seizure? Fit or a seizure is a condition in which there are certain kind of manifestations, either in the form of movements or psychomotor variety, due to transient excessive electrical activity in the brain. But just because patient has suffered a seizure does not mean he has epilepsy. Sometimes patients may have just a single small seizure, like if he has a head injury or if a baby suffers a fever, but that doesn't make the person epileptic. A person will be called epileptic only when he suffers two or more seizures and there is no transient reason for the same, such as, for example, fever or head injury or alcohol consumption. So somebody who's had two fits makes epilepsy. Now, what are the common causes of epilepsy? Common causes are head injury, infections such as tuberculosis, worm infestations, stroke, paralysis, and several other. All of them ultimately end up causing trauma and injury to the brain and make the brain what we call epileptogenic. What is the pathogenesis? That means, why does the brain throws a seizure or a fit? That is because when there is damage to the brain tissue, the normal electric currents that get generated in the brain, which are responsible for all the functions that we perform, they get deviated and they get either short circuit or there is formation of excessive electric currents, and these then spread all over the brain, leading to the common manifestations. Now, what are the manifestations? The common is what we call a tonic-clonic fit, in which the patient suddenly falls down unconscious, has posturing abnormal of his limbs, followed by jerking with froth in the mouth, and he bites his tongue usually, and many times he passes urine or motion involuntarily. That is called as the big, or in the olden days, grand mal fit. There are smaller types of fits as well, such as blank episodes in which there is abnormal psychological activity, and there are another variety of fits called as myoclonic jerks, in which patient suffers a transient jerk of all over the body. So there are several types of fits, and they can manifest as singularly or in combination. Now, how do we diagnose? We diagnose with the help of brain scan and another test called EEG, which long form is electroencephalogram. A scan is commonly done as soon as it is feasible for the patient to perform, and it will show many problems such as head injury, brain tumor, brain infection, paralysis, that means we call stroke, etc. On the contrary, EEG is another test in which the brain is wired and electric currents getting transmitted within the brain are measured, and abnormal kinds of electric currents can be picked up, which helps us make the diagnosis of epilepsy and select the right medicine. Remember, epilepsy is a completely treatable illness, and actually some of them can get complete cure. There are very good anti-epileptic medicines available, and as we speak, in the last 20 years there has been a big revolution and discoveries of several dozen anti-epileptic medicines. As we speak, around 15-20 good anti-epileptic drugs are available, which can be used as single or in combination to control fits. And if the patient takes medicines regularly under guidance of a good doctor, then over the period of 2 to 4 years, the majority of the patients can become free of their attacks, and in a lot of patients the medicines can be stopped. Now I am very keen to address this issue of social stigma. Patients who have epilepsy really suffer in a dual way. The society also looks at them in a different way. They are not taken very well in their profession, in their companies or offices. They are discriminated. Also, their other peer colleagues look at them as inferior people. Also, they have problems with marriages, settlement. But remember, many eminent personalities such as Napoleon Bonaparte, Vincent van Gogh, and these people suffered epilepsy, but they still lived a normal life, and not just normal, they made exceptionally good careers for themselves. So remember, epilepsy is not to be scared of. It is a completely treatable or curable illness, and it has treatment, and a person can lead a normal, healthy, functional life. Thank you very much.